Hello, everyone. Welcome to another Insights from Women Leaders series session. My name is Rola Kaakeh. I am the host for this series, and I will be talking to the guest leader today. Now, a little background on the series for those that are new to the series. We launched the series in October of 2020 to highlight the journeys and contributions of various women leaders who share their insights on a range of topics impacting their industries, our communities, and their role in shaping the future. Our guests have included leaders from various prestigious and reputable institutions from across the globe. Their backgrounds are diverse, their accomplishments many, and the insights and perspectives provided have been extremely valuable. The goal is to learn from women thought leaders and decision makers to empower current and future leaders, both men and women, to positively impact organizations and communities. Diversity of thought, experiences, industries, education, and training is important to us as it highlights the mosaic of perspectives represented in different settings that help drive decision-making and positive change. Now, I will have a conversation with the leader first using structured questions that we've traditionally asked our guest leaders. We ask our guest leaders similar questions throughout the series. This allows you to see the differences in responses and lived experiences. After that, I will ask questions sent to us from our audience or from the public prior to the session. So if you find yourself wanting to ask these guest leaders also for future sessions, you're welcome to submit your questions on our website. Now it's time to welcome our guest leader, Molly McCarthy. Molly is the National Director of the United States Health Provider and Plans for Microsoft. Her career journey spans 27 years in the health and technology industries. She is passionate about uniting technology, clinicians, and patients to improve care delivery, safety, and outcomes. Molly joined Microsoft in 2013 and served as the U.S. Chief Nursing Officer until August of 2020. She currently leads a team of industry clinical and technical subject matter experts that drive digital technology innovation and transformation for health provider and payer organizations. Molly graduated with a BS in nursing from Georgetown University and worked clinically in neonatal intensive care and pediatric units and as a pediatric kidney transplant team leader at Stanford Children. After her finishing her MBA, she integrated her clinical background into a career in medical device design and health technology. Molly started in a product development role at Natus Medical in Silicon Valley. She furthered her career in product concept to launch an AWHONN or AWHONN, where she was responsible for piloting a benchmark database that extracted data from hospital labor and delivery EMRs to provide business analytics and intelligence to hospital leadership. Immediately prior to joining Microsoft, she worked for Philips Healthcare Patient Care and Clinical Informatics Division, where she orchestrated large health system integration of patient monitoring networks into hospital EMRs and networks. So an immense background in different areas. So I'm very excited to have a conversation with Molly today. So welcome and thanks for so much for joining us.
Thank you. Thank you so much for having me. I'm heading up on, I guess, 28 years now. So time just keeps moving. It's a pleasure to be here.
It's awesome. Yeah, it's amazing sometimes. I love when you sit back and hear the bios, right? People are always just like, wow, has time flown? But so the question we always start is, especially as you're kind of listening to your own bio and thinking through that, did you expect to be where you are today?
No, I mean, just, I started off in nursing, and I have to say I did have a passion for technology early on in my career, and also a desire to merge my passion, I think, of healthcare and business together. Very early on, actually, when I was a freshman in college and METS, we had this class called Introduction to Nursing, and we had leaders come in with different backgrounds. For example, we had a nurse who went back and got her law degree. We had a nurse come in who went and got an MBA, who was more on the entrepreneurial side. So I was exposed to that early on in my education. And to me, that was just thinking about how could I, as I grew in my career, how could I continue to differentiate myself, my talent and my skills, and bring that to the table. Never did I think about Microsoft. I would say probably med tech, but being at Microsoft was not really in my sphere.
Yeah, it's amazing too. As I think about this, it's like there's certain instances that no matter how long ago you kind of remember in terms of shaping your perspective as in terms of non-traditional roles or wait, hey,
Right.
you can do something else, but also be passionate about this area. Yeah, it's amazing. I feel like I found this regardless of the people that I speak with and regardless of how long they've practiced, right? They can tell you there's a specific instance where they met diverse people that actually allowed them to broaden their perspective about their fields. But yeah, and definitely sometimes we think about like the specific institution that we want to work at, and then sometimes we think about what we want to do, and then the institution kind of comes, which is cool. So what we do is we focus more, well, we start off with the future in mind, and then we're going to come back and talk a lot about what you're currently working on, what you're doing, and then we'll talk about leadership. So
Great.
When you look towards the future, what is in your future? What do you want your legacy to be?
Good question. I think for me, even listening to when you were reading my bio, the one thing that really stands out for me and what drives me, I think, every day and will continue to drive me is just really my passion for ensuring that our patients can navigate the health system in a more holistic way. And obviously, from a technology standpoint, my goal really is to help make those connections in a digital world, as well as, quite frankly, in a face-to-face world. And so I really want to continue to improve that journey across the healthcare ecosystem, both here in the United States and really in my future, I want to really work on a more global level. So that's something that I'm aspiring towards right now. Couple other things I think that come to mind is I really want to make healthcare easier to access and regardless of who you are or where you are. And that means, not just in the four walls of a hospital, for example. And then building on actually that last piece is I really want a health and wellness focused system from, payer to provider to device. When we think about the entire ecosystem, not just focused on that acute period, but really thinking about, as I mentioned before, the entire journey, because a lot of what happens in a person's life and within their health and wellness doesn't happen in the hospital. So really looking to new models of care. So that's where I hope to take my career and really make an impact within healthcare over the next 10 years.
Yeah, that's really great because I feel like those are very foundational elements, right? Access is a big interest of mine and our organization in general, but I think it's just one of those things it's a fundamental thing we take for granted in a way, and we realize that there's still so much opportunity there. And I feel like now, even as you said, like to be more in the global space, but it's like, I think during the pandemic, in no time has we felt so global, right? So connected. So to see that as kind of integrating all those different elements, and that we don't just care about having access within our communities, it could really have an impact beyond that. So that's wonderful. Now, as you think through also your past experiences, have you always been interested in this area, or what's really shaped your outlook on this? Or has this now been kind of a new focus area of yours?
I think it's just evolved as I've evolved in my career, and quite frankly, as I've had the opportunity to say, yes, let me try that, and just really be curious about how things work. When I say things, I mean technology. I started working as a nurse in the mid-90s, when most devices and instrumentation that you used on patients, for example, a patient monitor might be connected to a central monitoring system at the nurse's station, but really standalone devices where you would take a reading on a patient, print out the result, and put it in a chart, tape it in a chart. And, thinking about how we've become a more connected society over time. So you talked a lot about my past with Philips and AWHONN, where we were looking really to not just collect information and data and make decisions on it at the patient's bedside, but how can we collect that information and data and think about it in a much bigger, population. So for example, the patient monitoring systems, integrating those into the electronic medical record, into the hospital networks, et cetera. And so now we don't just have these standalone devices and data points. And that's kind of how I evolved in my career as, I started to work and see where we were going with healthcare in terms of not only the making everything digital, but then kind of where we are today with massive amounts of data, and how can we use that data, not just to, retrospectively analyze what went wrong or what went right in the situation, but really to make decisions real time on that patient at the bedside. And, I think just now working for Philips, and then Microsoft essentially contacted me and said, and this was actually 9 years ago this month, we're looking to bring in more health expertise to start to drive the conversation outside of IT. We want to bring in people with that health knowledge. I wouldn't say that I understand technology, but I don't necessarily go out and code every day. So really enabling Microsoft at the product and engineering level, as well as the sellers level, to really understand what healthcare is all about and how we can have those conversations with IT, but then also with other stakeholders outside of IT. And that's kind of a long-winded question, long-winded answer.
No, yeah, it's always really nice. I mean, technology in itself has evolved so much. And I think the way that you, it's just like, even for me, it's just like, I went from, even when I did rotations and things like that, it's just like, you'd go to hospitals and, everything was paper charts and it's just so different. Right. And then you also go into the most advanced health system that has all the technology, but then you also realize every time you make a change, there's a whole system of processes that go through that. So it's just also so interesting to see, not only has it evolved in advance, but also how that changes workflow and adapts. And it's been also so interesting to kind of see on our end as well. Now, can you share some maybe failures or challenges that you experienced that also shaped your current outlook or future outlook, or maybe makes you do things a little bit differently? Maybe something that you wished you would have done differently, or now actually make a cautious effort to change into the future?
Yeah. I can think of a lot, but I'm going to name one that really stands out. And that was when I transitioned from a clinical role as a young nurse into the medical device world. I worked for a company, you mentioned them, Natus Medical, that actually worked in the area or built manufactured products in the area in which I worked. So mostly, for example, maternal and child, pediatrics, NICU. And we were looking to launch a product, and we did launch a product. At the time, it was called the COSTAT End-Tidal Breath Analyzer that measured end-tidal carbon monoxide in baby's breath as a way to potentially predict whether or not they were going to get a specific disease called jaundice or hyperbilirubinemia, which happens in a large majority of newborns. But if you could predict this prior to them leaving the hospital, then you could potentially avert some adverse outcomes, et cetera. And we worked in conjunction with a lot of the top-notch research groups. We had clinical trials going all over the world. and I look back at that, and one of the biggest challenges, I would say, is bringing technology to the market before I think clinicians were really ready to make the change to their workflows and understand the impact. And I see this today as well, actually. And how could we have better included clinicians perhaps in the early on design and development, of the device, of the change in workflows, so that user feedback, or not user feedback, but really that adoption of that new technology would be welcomed. And so that's one thing that I always say today, during my time here at Microsoft, you'll hear me say this when I speak publicly, but including clinicians in the design and development of solutions, not just the deployment, but bringing them in to those first conversations so you can truly understand the clinical problem and what needs to change is critical for the success of everyone, quite frankly, whether it's the engineer, the marketer, the salesperson, the clinician, the hospital, and ultimately, the patient. And it really goes across any type of product development, I think. And so I'm really passionate about that product development process and ensuring it has those inputs from the appropriate stakeholders.
Yeah. No, that's a wonderful point, because I remember thinking also too, it's like, as technology was being integrated within different environments, you can just tell, like the clinical team would be like, it's obvious they didn't talk to anybody that's in the clinical team about this, because from a workflow, and then they don't adopt it because they're like, it just messes with our workflow. It's not useful, or we don't know where to find things. And I think now even the amount of credibility when you associate, like, we've been building this, but who helped us build this is someone that also experiences your pain points. They understand your workflow. I think there's just so much credibility to actually even then using that, because you can tell very much when it's like, this person just doesn't understand what we're going through. I'm amazed that it's wonderful technology, but it's not going to, help me if it's not what I need. So that's definitely evolved. So that's a really great point. And I think even across probably anything that you're working on, if you don't have the target audience or those that are using, it's helping design it in a way, like you said, like it impacts everybody within that. Company. It's not just the product that it impacts. Impacts everyone across the company for sure. So as you think about the future, what excites you about the future?
What excites me about the future? My gut is to say, I can't wait till everything with COVID is over. But, in seriousness, I think moving forward from where we've been the past 2 years, in healthcare with the pandemic, the learnings that we can really take forward. And also knowing that a lot of transition and transformation was happening in the healthcare industry, albeit slow. And myself thinking back to, I remember in the summer of 2019, I was presenting at an AI and cardiology seminar out in San Francisco, and we had half the room who was fearful of AI and the other half like, yes, bring it on. And thinking about, I remember feeling like, are we ever going to change within healthcare? What is it going to take? And then honestly, within 6 months, with the pandemic, really jumpstarting and kickstarting healthcare systems, plans, et cetera, to make the changes that they'd been thinking about, perhaps doing a proof of concept, but even the concept around a video visit. I've been talking about that for 5 years with so many different customers. And I think I'm excited because I look at what's happened within healthcare over the past couple of years, and it will really shape where we're going in the future, not just from a tech perspective, but even thinking about what our clinicians are doing and what they shouldn't be doing, and how can we continue to enable them to work at the top of their license? How can we get more information in that patient and family's hands or in their phone to make better decisions about their own care, as well as have choices in their care, where they get it, have transparency with pricing. That's another big one for me. Within every other industry, if I'm buying something, I pretty much know what I'm paying. One of my kind of pet peeves within healthcare is like, I want to know upfront, like if I'm going to need like an MRI of my ankle or whatever I'm needing, I want to understand, like, what is that going to cost me at the end of the day? So you asked me what am I excited about? I think taking everything that we've started, prior to COVID-19, throughout COVID-19, and coming out, and how can we really learn and continue to improve our health system. Like I said at the beginning, really making it a better experience and more accessible for you and for me.
Yeah, that's a great point. Yeah, the price thing always gets me too. It's amazing. Like, even if you try to understand and try to get more information, it still surprises me, because it's like, well, it can start anywhere from, I'm like, but is there a range? Like, it's like endless. So yeah, it's definitely one of those things. But like you said, with access to more information, transparency, the ability to be able to have access to your information, to be able to make better decisions, that's all very exciting. And the ability now with technology to get to collect so much data and then leverage that data for sure. We are very actions oriented too, and like we think a lot about skill building as part of this series. So what do you think like are some tools or things that we should consider, or skills that we should build as we move forward too?
You mean your organization?
Oh, in general. So as an individual, I'm now talking about, like, for our audience as kind of individuals that are really looking to tackle these big issues or problems, regardless of what their areas of focus are. But, given the reality that we're in and probably into the future, are there tools or things that like we should think about as we build our skill set?
Yeah, I think, one thing that in general that's really helpful is kind of thinking about when I was talking about the product development process, is that somewhat, empathy, understanding what someone else is going through, and having worn their shoes, so to speak, even if it's just, I think about like a ride along, maybe working. I always love when I could, is to go back into like a hospital setting or a clinic setting, or even, a medical device company. And some of my favorite days, I actually remember one day at NIH where I got to completely gown up and go into the OR, but just really understand and see it from my customer or even the patient's point of view, what they're experiencing, and educating myself so that I can take that back to my work setting and hopefully use that information to improve, whatever we might be working on. So I think one tool or one skill is just having the ability to walk next to someone, or walk with them as they go throughout their day, whether it's a clinician or a patient, just so you have that deeper understanding, rather than just pontificating about it, so to speak, but that real world experience. And I know that's hard right now, because we live in the virtual world and Zoom and Teams, et cetera. But I think that there's nothing for me that is more gratifying than having that face-to-face, those conversations, and that understanding firsthand of what is happening in their environment, and how, in my case, how can we potentially use technology to make it interoperable, to make it, more access to information and the data. So that's one thing that I always think about.
Yeah, that's a really great one. Okay, so now let's talk about the present. So are there current initiatives that you're working on that you're really excited about or that you want to share with our audience?
Yeah, so I think, I mentioned thinking about the past couple of years with COVID-19 and some of the activity that was going on before it. I am really excited that my team has been working on ways, and I guess from a tech perspective, obviously, but also non-tech, is how can we help improve the workforce, healthcare workforce, the challenges that are going on, the burnout, the documentation burden, and really partnering with not just, our customers, but thinking about, for example, conversations with the American Hospital Association, et cetera, but how can we come together as stakeholders in the healthcare system and address these, and not just address the worker, whether it's a radiology tech, whether it's a physician's assistant or a nurse practitioner or a physician, surgeon, et cetera, but thinking about not the individual or the team, but really thinking about the workplace and the environment in which these humans are working, and how can we improve it so that there is more incentive to stay, and really just acknowledging all the work that they've done over the past couple of years and building on that so it's a healthier environment.
That's a great one too, in terms of great focus area. And I think that's a challenge that a lot of people are also thinking about in terms of trying to improve upon. I know it was a conversation even before the pandemic,
right?
And then obviously it completely amplified during the pandemic for that. So the next question actually also pertains to obstacles and challenges. So you mentioned burnout and creating a good environment within these systems. Are there any other obstacles? I mean, there are many challenges and obstacles, but anything that you really worry about or kind of keeps you up at night?
Yeah, I mean, I would say it's probably around just, thinking about those who are on the front lines every day. And it's obviously getting better, but thinking about the mental toll it's really taken, quite frankly, on everyone around the globe over the past couple of years, but especially those who are working with patients and families every day, just the mental impact of, for example, being the only person in the room when a patient's dying because they have COVID-19 and there's no access for family or friends to come in, and doing that over and over again. I'm just concerned about our nurses, our physicians, everyone on the front lines who are giving so much. And what's the fallout going to be in a month, in 12 months? I think we're seeing it in some respects with the massive amounts of nurses leaving the bedside, or, even going to take for example, a travel assignment or temporary assignment where their pay is much greater. But how can we, so I worry about that. And, think about how can we look at that, and instead of freaking out, so to speak, but really, how can that result in something positive. For example, new models of care, working to the top of their license. How can we get rid of the extraneous tasks or, for example, documentation burden? I spoke with one large hospital that was looking at hiring people just to come in and scribe. And I was like, we can work with you on that through ambient clinical intelligence or other ways. And I hate, in general, I hate to just throw a solution at tech solution at anything, quite frankly, for all the reasons we just spoke about previously. But I think that, I think that we're really going to need to shift quickly in order to avert the snowball that's happening, the snowball coming down the hill, and just people are just leaving because it's unbearable.
Yeah, for sure. We've definitely heard it kind of across the different positions within healthcare, but I feel more so we're hearing it a lot with actual our nursing colleagues, which is sad because they do so much, right, for patient care. So now let's transition to talk about success. And so when we're talking about the topic of success, let's start with, how do you define success?
How do I define success? Well, first of all, it's really personal. For me, and I think for anyone, it should really be personal for them, because I don't think that we should succumb to any other person's definition of what success is. And, I think for me, success is many different things, but typically how I achieve success, or I achieve kind of what I've set out to do, is I always like to have goals, and I like to have a plan. Not that it always works out, but I like to, even like starting my year, I don't make resolutions per se, but I do like to understand, like, what is my year going to look like professionally? Like, what are my top 3 goals that I want to achieve this year professionally? I talked about having a global presence. That's one of them. But I also, for me, it's not just professional, it's personal. I have, a husband, I have 2 boys, I have a dog, and thinking about, like, what do we want to do as a family this year? And thinking about each individual, and where are they going to spend their time during 2022, either together or separately. And so for me, going back to the question of success, I think for me, it's at least sitting down and putting together somewhat of a framework of things I want to do this year, professionally, personally. Even, for example, I signed up for a half Ironman triathlon, and I actually officially started my training yesterday. So I think just having those little goals each year is important, but also for me is to take a step back and not just think about that plan and goal every day, but also be flexible and know when to pivot. And I say that because, life doesn't always turn out the way that we anticipated or planned. And so for me, while I like to look at the year, I also know that I'm, day by day, or really week by week, is how I plan. And to me, that's just success for me, like knowing that there are all these different components of my life, and having some semblance of a plan, and then living and enjoying it.
Yeah, that's great. And I love how, because you started off with saying that the definition of success is very personal,
Right.
But then you also made note that even how you measure success integrates then your personal life too. Because we often assume that if we just define success, it's going to be professional. But if it's of your own personal success, right, there's got to be that element of your own also personal life within that as well. So as leaders in general, we know that we can't do everything ourselves, but asking for help or support is actually difficult for some, and because everyone's needs differ and just kind of their whole perception of what it means to ask for help. So what does support look like for you, or how do you really prioritize the conversations around support or seeking help throughout your professional career?
I'm kind of chuckling because you asked that question, and the first thing that comes to mind for me is back in August 2020 when I took this new role, and my son was a senior and my other son was a freshman in high school. I was like, I can't cook anymore. I can't cook. I hate cooking and I'm not that good at it. So I would say, like, one of the biggest things that I did over the past year and a half when I took on this new role, I was like, my husband, who's incredibly supportive and a great cook, has just kind of really taken that piece over. And I know that sounds silly, but it's just a huge load off of my mind and back. And he's really good at it and enjoys it. But it's kind of it's just a little example of how it's almost like you need to understand kind of what's going to break you or make you. And knowing that he actually enjoys that. And that's really something more personal, I think professional too. You need to think about, is there something that I'm doing that is not really a good use of my time and that I can give to maybe a more junior member of my team who's looking for a growth opportunity. So that,
or that enjoys it.
Or that enjoys it, exactly. Yes. Or really,
you're like, wait, there are people that enjoy doing this. Let's, regardless of personal or professional, like, hey, no, but that's great. Because even if it might seem like I was smiling, because I was like, it's actually a prime example too of sometimes we think that sometimes support or what you need help with is sometimes not what you like think of first, right? So if you're overstressed, you're trying to think of everything. So then you really need to understand what it is that could help ease things. And it's sometimes, you know, that being support in something personal can significantly impact and help something that's professional, right? Like it's not even just always just related to that, but yeah, for sure. Now let's talk about leadership in general. We ask all of our guest leaders to define or how the question of how would you describe a leader? So can you tell us how you would describe a leader, and can you elaborate what's really shaped your outlook on this?
Yeah, I think this is a tough one, and I've thought about this a lot throughout my career. You know, obviously I've never thought a leader is someone who's in a specific role or position. To me, it really can be anybody. And I played sports my entire life, and I do, you know, really important to me in terms of the team. But a leader to me, and someone that I really aspire to be, is just someone who I think is keenly aware of their surroundings. For example, their physical surroundings, the people that are in their environment, and really picking out kind of the positives from, you know, each team member, for example, and bringing those forward to create a positive impact. In my case, with work, you know, it's making a positive impact in healthcare through technology. Hopefully at the end of the day, as you mentioned kind of in my bio, it's bringing together tech, you know, to really better the clinician experience, the patient outcomes, et cetera. So really being a leader is to really, for me, is to understand what's going on around me. And even if there's negative aspects of it, really pulling through all of the positives and moving forward with those to make an impact in society.
Yeah. That's very nice. I think the topic of leadership, I mean, the word leadership and kind of the topic of leadership has kind of become like either a buzzword or a topic that like people kind of throw around and talk a lot about. There are thousands of books and articles and everything about leadership, and it's kind of changed and also evolved in different ways. But what do you think we're getting wrong about leadership?
One of the things, our kind of mantra at Microsoft from a managerial and leadership perspective, and we've done a lot over the past couple of years. We went through Brene Brown training and just, being vulnerable, et cetera. And I had someone tell me, "Oh, Molly, you're too honest. You're too transparent," the other day, but in jest, of course. But I think, as leaders, we're not going to get everything right. I think it's how you react or don't react and how you communicate, especially in today's world where we're mostly virtual. And I think about three concepts that we focus on here. And that's one is to model the behaviors we want to see in our teams, to really act as a coach. And that goes back to my I think my passion for being on a team, and always, whether it's an athletic team, a professional team, or my family team. So that, coaching aspect rather than preaching or, lecturing, et cetera. And then the last piece, which I hope is inherent in who I am and why I went into healthcare is the last component is really just that caring piece. At the end of the day, we're all humans, I think. And, we have, we don't come to work every day or wake up every day to say, "Oh, I'm just going to wake up and do a terrible job today." But, things happen throughout the day. And so as a manager, as a leader, having the ability to care and to really demonstrate that through and through.
Yeah, that's fair. So building upon that, in terms of kind of the what you're focusing on, what's important kind of to you as a leader, is there any other leadership lessons or advice that you want to provide our audience that are either current or future leaders at varying stages in their career?
I think just, as a leader, or just as you move throughout your career, be courageous, and be willing to take that risk. As I mentioned, as you asked me, did I ever think that I would be where I am today? No, but I always have said yes to new experiences and new opportunities, even if I don't think that I'm the most qualified or the smartest or the best person. I'm curious and I want to know more, and I want to be a learn-it-all. So, I think as a leader, for me, it's important to, if I'm hoping to bring my team along with me into new frontiers, for example, with tech and healthcare, we're doing that. It's important to not just dip my toe in the pool, but really fully submerge myself and bring the team along. So I think, just willing to dive in.
Yeah. The courage and curiosity combination is definitely a powerful thing there. So before we go to our audience questions, we do, as kind of our last question, like to take an opportunity to support one another and recognize the positive influence we have on one another. Can you name a woman who has inspired you, and why did you choose this person?
A woman who has inspired me. Well, I can think of so many along my life, but I would probably just say my mom, who inspired me to be adventurous and courageous, maybe sometimes stoic. And she's really the reason that I've gone into healthcare and have a passion for really improving that patient journey. She was diagnosed with chronic myelogenous leukemia when I was 16. She was 44 at the time, and she was incredibly brave and strong and did whatever it took to really fight the cancer. She unfortunately lost her battle in 1993 when she was 49, summer between my junior and senior year in college. And so she really has shaped my attitude and my curiosity and my passion for making the system a better system for patients, but then also she's really just shaped my outlook on life. And, you're only here for so long. And so you might as well take that risk. So I'm gonna say my mom.
Wonderful. And kind of definitely see the underlying courage element there for sure. That's kind of been I feel like a theme throughout. So now we're going to transition to some of the audience questions. A question we get a lot in this series, because our audience is, they vary in terms of where they are professionally, how their leadership roles. And so, but kind of consistent theme across the board, I think no matter what position you hold or what you're doing, is the skill set to be able to adequately engage with diverse stakeholders, have good communication across different groups of people that might think very differently. But although we all know that's very important, it's also very difficult. So is there any advice or strategies, because we had so many questions on this, in terms of engaging with diverse stakeholders and, effectively communicating and working together when you have such opposing views on a matter?
Yeah, that's a great question. And, when I was just even reflecting on my own career and some of the challenges, that's probably, that just remains a challenge, I think, in any environment, whether it's personal or professional, because you have various stakeholders with seeking different outcomes. Professionally, I think when I look back to where I started professionally, it was, as a nurse at the bedside with that patient. And my role was to advocate for that patient and get them whatever they needed, whether it was, a CAT scan, whether it was to get them down to X-ray, to the OR, to transfer them into intensive care. But that was a skill, I think, when I look back on my career, that I've been able to transfer throughout my career. And that is that communication piece to all the different stakeholders and really getting everyone to try and move in the same direction. And that was, as I mentioned, something that was transferable, because when I think about my role today and what I do today, it's a lot of the same things. It's garnering that support from the different, whether it might be a software engineer, hardware engineer, salesperson, the end customer, but really understanding it from their perspective. I always like to meet, if I have like a group or a virtual team that I'm, for example, putting together on a specific initiative, maybe it's healthcare workforce crisis, not just bringing them to the table, but first of all, having met with them individually before I bring them all together is, I've found, really helpful, just to understand where they're coming from. And then when we do come together, really having a specific agenda to drive through. I can't stand coming to a meeting where there's no agenda, but bringing those stakeholders together with specific kind of endpoints, almost like, project management to some extent. But at the end of the day, I think I said this earlier, but it has to be a win for them. They have to be getting something out of it. And not just on an individual level, but I think enabling them to see the micro picture in terms of what they're doing in their role, but also the bigger impact that the team will have.
Yeah. And I feel like this is something I've noticed throughout our conversation right now too, is your focus on the other first, and like making sure that you understand what it is they're going through or they want before you kind of approach it your way or try to think through about what's important to you. Because I feel like oftentimes people are so focused on like, how am I going to communicate what I want rather than, or what I think, versus, you know, taking that time to really listen and understand, which is something that you also mentioned really early on in our conversation around kind of that, to have empathy and walk in their shoes and try to think through what is important to them. And then that actually makes it also more meaningful in terms of the conversations you have, because, you know, people trust other people when they feel like they kind of understand them more, right? Like, and so there's that big element too of communication is trust. And so how you definitely establish that is great. There's also several questions in different capacities, of course, from our audience around prioritizing what you work on, time management. You know, obviously with very ambitious individuals, there's many things that they want to work on. So many questions on how do you prioritize what you work on? How do you kind of manage your time around that?
Yeah, and that's just an ongoing art, not so much a science. But I think even now, like thinking about my team, and really if someone's coming to them and saying, hey, can you do this webinar with this partner, et cetera, I have become I scrutinize like every request that comes to us, because we get a ton. And people want to have that industry perspective, that clinician perspective, or that, you know, tech perspective. We have former CIOs on our team. We have nurses, physicians, former healthcare administrators. And so I feel really protective of their time. And to some extent, I want them to be working to the top of, you know, their knowledge, so to speak, their license. So very picky about time, and really, I really want to understand like what, like who's the audience, who's going to benefit from the information. And the other tricky thing is, we're obviously a publicly held company, but, you know, will this impact our customer base? And when I say our customer base, I mean, within HLS, at Microsoft, we have, you know, 200 and some provider and plans that we specifically work on, even though I know there are many more in the universe than that. But so it's really being, asking difficult questions. You know, I had someone come to one of my team members, well, actually, they came to me in September and said, we would like to bring your team in to do a few different meetings in December. I said, okay, who's going to be there? You know, who's the audience? I asked them a slew of questions. I never heard back from them until the day before, 3 months later. And they were requesting time for the next day. And I said, no, I asked you these questions 3 months ago, and they're so used to us just saying yes. And we are a team of people that say yes, we want to help. You know, we want to do whatever it takes. But there comes a point in time where you just have to ask those tough questions and say no.
Mm-hmm. Yeah, so it's true. Part of, you know, having multiple interests is the power of saying no, for sure. One last question before we kind of end it, because I think it's just kind of a nice one. What advice, it can just be very simple, would you give your younger self?
What advice would I give my younger self? I think I would give my younger self some advice that was given to me probably later on in my career, was fake it till you make it. Or my sister said to me, you know, just pretend, if you don't have confidence, just pretend like you have confidence, and then you'll have confidence. So really just believing in yourself and knowing that at the end of the day, I mean, the only person you really need to please is yourself. And And once you do that, it'll just trickle down around you.
Yeah, that's great. I feel like growing up too, I used to always hear that. And then I don't remember when exactly, but I heard a different form of that, where I think it's kind of like what your sister mentioned about fake it till you believe it.
Yeah.
And I thought, I was like, wow, that's actually stays with you longer, because
right.
like till you make it, you realize like, okay, you made one milestone, but what if it changes?
Right.
And you're gonna
yes.
But then that whole fake it till you believe it became exactly like your sister. Like if it's confidence, then you become confident. Like if
right.
it's this, then you become that, right? Like if you fake that, like, you're a hard worker, you're going to put in the time and you become a hard worker, right? Like, and so there's those different types of elements, but yeah, that is really great.
Yeah.
But
I think just saying it, like putting it out into the universe, like, yes, I am going to do a half Ironman triathlon in June with my friend, and, you throw it out there and boom.
Yeah, so. Because you are that person, right? Like to become that, you have to be like, okay, well, I'm going to do this in order to become that. I have to like run and all this stuff. But more power to you, my friend. Like that is definitely an accomplishment. I'm just trying to get back into shape right now because of the winter for sure. But this has been really great, Molly. Thank you so much for taking the time to have this great conversation with everybody. I know that there's just so many different elements. Definitely love the theme of being courageous, curious, the humility part, and really trying to understand, who it is that you want to help and put yourself in their shoes. I think that is very, very, very powerful. And kind of to be authentic within that. And I love the merge of the both personal and professionalness. And I think a lot of people see that for themselves as well. So thank you again. And for everybody listening in, if you'd like to hear more from various women leaders, you can check our website, salusvitaegroup.com. So thank you again, Molly.
Thanks. Have a great day.
Bye.